Now, one of the fears of first aid is putting your mouth down on somebody else's mouth because you're fearful of infection or touching any other bodily fluids like vomit or saliva. And an easy way of protecting yourself and giving you more confidence is the use of a CPR face mask. The CPR face masks, there are lots of different types of them. We're going to have a look at those in a second. And what they do is they provide a barrier between your mouth and the patient's. Now, yes, this will stop the potential risk of infection, but also it gives you a lot more confidence in delivering CPR breaths much more effectively if you're worried about putting your face down on somebody else's. Now, if they have facial trauma or if they've, you just don't want to do it, then you can just do compressions, and we'll cover that in other videos. Now, the face masks themselves, there are lots of different types. Now, a common one you see is the ones in the little pouch, which go in a keyring, or you can attach this to the corner of a first aid kit. What this does is it just opens up, and inside is the face mask itself. So this particular one, you open up, and once it's open, you'll see all the instructions where to put it on the outside. Now remember, this goes on the patient's face, not on your face. But you've got an area where you can mark where the nose is, so this goes over the nose, and this one has got elastic that hooks behind the ears. There's a very easy way of securing this onto someone's face. Especially when doing CPR, having this type is good and easy. Now, more common ones are this type, which is a standard sheet of plastic, and on the front there it's got a filter paper. And this filter paper is what you're actually blowing through. So you've got a nice large piece of plastic that goes over the face completely, and then you're blowing through that filter paper. You can easily, with these, squeeze the nose, it's no problem, just squeeze through the plastic, and then when you're doing the compressions, you just leave it in place. And then when you come to do it again, make sure it's in the right place, and then you can use it again. Now we'll have a look at this in a little bit more detail shortly when we put it onto a patient. Other types are available are ones with a plastic valve in. Now this is one with a plastic valve, and this valve is a one-way valve, so it only allows air through this way, and when they blow the other way, the air can't get through. These also do come in the keyring type dispensers, but they are a little bit bigger. So a common one in the first aid kit, and these are now standard practice in BSI first aid kits, is to have the paper ones because they're a lot flatter and easier to use. But this system works really well, in fact slightly better because it's got a better valve system with it. Variations on this are these two. And this is a valve system, and what you have here is the part you're blowing on this end, and this bit just goes beneath around their lips, so you just blow in there and it provides a barrier. And this one's similar sort of thing, but a little bit bigger, and that just goes into the mouth, on the tongue, and they can just blow in through that. Now there is another one which we'll look at. This is the pocket mask. Now this pocket mask works slightly different. It's a complete mask that goes right over the mouth and nose, and you push that out and you can blow straight through the end. And we'll look at that in a separate video. So what we're going to do now is have a look at the filter paper ones, and these will be in a sachet like this. So this could be inside of one of those keyring pouches, or this is how it will come in the first aid kit. So we'll just look at applying this onto a patient. So we're just going to now look at how to apply a face shield. And this one's in a sealed packet. There's two little nicks in the corner there, so you just literally just tear it, and that will reveal the face shield itself. Open it up, and once you've opened it up, you'll see the side that you can read. So this side you can read properly. The text is backwards, so that goes on this side. You can see exactly where it goes by the ears and the nose mark, and you lay that over the face of the patient that way. So you can see it's a very big covering over the face. You can quite easily with this squeeze the nose, and then you just blow down straight into the hole here. So easy to open up the airway, squeeze the nose, and blow air in. So that is a simple way. It will stay on his face while we're doing compressions, and when we come back, we can just reposition it and use it again. If it does fall off, just pick it up and put it back on again. All of these face shields are all single use.